Hello?
To say hi.
Oh, you just said hi. All right. Hi. Aaliyah. Jamie. Oh, this is Jamie. All right. Did you think I forgot? Is everybody on?
Yes, doctor.
Let me see.
Yes, doctor.
No. Oh, sorry. Not to maximize. Okay. So there will be like 28 questions, and I think there's one probably that selects all that apply. Minimize, opt out. So I'm gonna tell you like what category it will be so that when you do your review, uh, like the slides, I'm gonna tell you to review the slides on safety, right? On falls. Uh, I'm trying to maximize. Hmm, out, minimize. Well, anyways. All right, so let's start with safety. That's including that we'll talk about restrain. I'll go over. I'm not gonna go over it, but I'll tell you like if it's the category of it will be. So start also for restraints. Uh, there's physical restraints review. You know the slides on restraints and different types of restraints. Um, what safety measure? For example, a doctor ordered you to apply. There's an order to apply um, soft restraints, soft wrist restraints, right? So you apply that. What is the most important thing? I think I asked you this last, and I mentioned what is the most important thing you as a nurse must should remember. And hopefully you learned that in skills this last week.
To reassess and check their vital signs in the limbs that it's applied to, like the skin integrity.
Well, that would be part of your documentation. But with the restraint itself, when you apply it, I think that's what I'm trying to say.
To make sure that they can still get out.
Yeah. So what do you call that? That technique?
Quick release.
Quick release, right? Did somebody say that?
Yeah.
Okay. So make sure that it is a quick release, because in case of emergency, you really have to, or somebody has to release that. It has to be that there just one pull will be uh, will do it, right? So that's very important. Have you learned how to do a quick release in Skills Lab?
No.
No. Yes, today.
No.
Today? Okay,
Yes.
some say yes, some say not yet. Okay, you'll learn it. Um, also for say it's an emergency, like there are criteria. You need to know the criteria, right? To why you need why you need to use a restraint. Again, restraint will be the last resort, right? You'd like to use something else, like let's say if a patient is confused, uh, what would your first action be?
To reorient system.
Well, yeah, but of course you have to reorient even the patient's confused. But would you uh, tie that patient or do restrain, or would you?
No.
Yeah. Okay. So what would be the best if you have a choice? Have a sitter, put them close to nursing station, restrain them. So what would be your first choice?
Have a sitter.
Close to the nursing station, that's the
Yeah. Your best choice will first put that patient in the nearest nursing station. And I think I mentioned this last week about I watched this because my father was in Claremont Manor and was in the rehab facility there, and patients who are confused, I mean, can have the risk to get up. They were placed outside, outside. I mean, nearby the nursing station itself. The patient was on a wheelchair, in in um, in being watched by the nurses, and they make them involved. They keep them busy. So that was kind of like I thought kind of cool. So they were actually within the eyesight. You know, the patient, the nurses can actually see the patient. So yeah, the closest will be your best choice instead of just restraining the patient. In regards to there's another safety will be fall, right? When you review that form about what are the how do you score risk for falls, right? History of fall within 6 months, the age is it counts, and then about 7 will be what high will be. You start the risk for fall precaution, and make sure at night, right? At night, if the patient is in the hospital, what would you what would help that patient to not to avoid falls? What would be the nursing interventions?
Having bed closest to the floor.
having the lights on.
Yes, having the bathroom lights on, right? That's number one. The, it's kind of like the night light, but we don't have night lights in them. Also orient them to uh, remind them before they go to sleep, and then inform them that I'm gonna leave the lights on so you can see. What else? What about clutter?
You want to make sure that there's no clutter.
Yes, make sure the room is not cluttered. Very good. Then so we talked about confused patient near the station. Perhaps the next choice will be a sitter, right? But restraint will be the last resort. Then we have another thing that you have to review. Um, Remember I told you I was a home health nurse, and when you do home health nursing, you just don't see the patient and then take the vital signs. You will assess the environment of the patient as well, right? So what would be the important what would be the concerns or the issues that safety issues that you need to address?
If they're being mistreated.
Yeah, neglect. What else? How about safety?
If there are any hazards within the home, like electrical wirings.
Yes, so make sure you inspect that. Make sure the cords are what? Out of the way, right? And safely tucked in some underneath whatever. And how about the area rugs? You need to teach them that too, right? They're not supposed to use area rugs because they can trip over that. That's for home health for home. If you were to identify the risk of the home, we talked about one of the criterias of uh, restraining patient is that when they try to remove IVs and NG tubes, right? For IVs, what would be how would you prevent the patient? How would you protect the IV site before, let's say, before restraining the patient? Think about ways, okay, an alternate to protect the IV site and still, I know, to not restrain the patient, but um, at the same time you are protecting the IV site. What would be um,
Would it be like
a-
Coban?
yeah, you apply something like Coban, but be careful with Coban because sometimes Coban can be can
It's tighter, yeah.
get tighter, right? Maybe just mittens, or no, stockinette, anything. Coban, I mean, yeah, I guess I'm trying to go that way, but
Well,
Coban,
during our lab too, they mentioned mittens, but isn't that like another form of kind of like a restraint? They said they use it with the babies, like.
exactly. But it should be something that will cover the IV. Maybe a soft uh, Curlix, or something like a stockinette, just to cover it, to distract the patient, for, as a distraction for the patient. Yeah, yeah. I know that I know that mittens. When I said mittens, I was like, oh, that's also a form of soft restraints because on the slide, the pictures, a mitten is shown there. You're right. The best choice will be stockinettes or a pair of, or a sock that you can like put on the patient. It can cover the IV site. Um, let's see. You also learn how to remember when we said about prioritizing your um, patients, right? Like you assess the patient. You see on initial on the start of shift, you should uh, check in the isolation patient last, but take care first of those who are not on isolation. So uh, you also, when it comes to safety, you also need to prioritize who will be more at risk for falls. And we kind of mentioned about the way to uh, the way the easiest way to do it is look at the scoring of the risk assessment for falls above 7. Remember that number. Um, so kind of review that. Infection control, right? Study that. What are the different types of isolation? We have what? Standard, and we talked about the standard means what? You treat everybody as infected, right? That they have some kind of infection. The PPE use is the only thing that you will really have to consider to review is that what PPE would you be wearing, or what are the different types of isolation. Then we have contact, right? We have airborne. And so, example of contact will be those with C. diff, right? Anything that has any patient with wounds that increase drainage. MRSA and TB would kind of like be airborne. And so with, let's say with C. diff, what would be appropriate for, well, it is a contact precaution, right? I kind of mentioned that. So you have to know the example also. So that, when you get a report from, uh, let's say, an ICU nurse saying, hey, you know what, this patient is C. diff, uh, it will be, patient was on contact isolation. So you will place that patient on contact isolation. And the only person that can room with that patient is someone that also has C. diff, same as our MRSA patients. Um, I, what else? How about airborne, the TB? What kind of room will you place the patient?
Negative pressure room?
Negative pressure room. Do you cohort that patient?
No.
No, because usually a negative pressure room is by itself only. Anybody, okay, so remember this. This is an add-on. Anybody that is admitted as rule out TB needs to be placed on a negative pressure room until otherwise proven that this patient is not uh, a TB patient. I had a doctor that I was in charge of an ICU at that time, and he was admitting a patient that he put rule out TB as diagnosis, and he wanted the patient um, to do a fluoroscopy and bronchoscopy and broncho washing, and he wanted it done in fluoro, in X-ray, and I said you can't do that because patient is ruled out TB. No, but that's I just put it there, and because he had a history of it, I said no, I know, doctor, but you put there rule out TB. It wasn't as a history of, but it's a current diagnosis. And sometimes you have to advocate not just the patient but for everybody else, that if that patient is truly rule out TB and possibly with TB, and if I allowed him to transfer that patient to X-ray department, then a lot of the patient and family who do not have TB might be exposed to it. So sometimes you just have to be firm with um, physicians. Let's see. You need to know the term. What is does anybody know? What if a patient is coughing? Uh, hem, hemat, I'm sorry, hematuria. What is pertussis?
Droplet?
Yes. So what kind of isolation would that be?
Contact, no, airborne.
Airborne droplet. Yeah, airborne. Very good. So you also have to know the term, right? The terms, the terminology. Good job. What are the signs and symptoms of tuberculosis? Night, night sweat, right? Loss of weight. Night sweat is also very, uh, what do you call that? Is a symptom. Know the different types of, wait, hang on a second, guys. Um, know the different stages of infection. That the prodromal stage, we have the acute illness. Prodromal stage, the incubation stage, the acute illness, and the period of convalescence. Know, know them and know example of it. Okay. Know those slides. Review them. What's so? What's incubation period?
7 to 14 days where the infection grows in the body.
Yes. And the patient, does the patient have symptoms?
No.
Not yet.
No.
Okay. So no. Review that. Okay. Review that part. And you'll be okay. How do you so for okay wait, what's a vector?
The patient that's getting infected.
Yeah, patient from what? What kind?
Animal.
Animals, right? Like example will be what? Exposure to, or the patient had
Mosquitoes and rats?
mosquito bites, ticks
Ticks.
ticks will be very common, especially those who live in a mountainous areas. Deer has a lot of ticks. Oh yeah, there's also a scabies. I forgot that. So when you are those are the what? Those are kind of like vectors, right? And you can be exposed to it, indirectly. I've been exposed to scabies. I told you that, right? As an ICU nurse, we didn't know that the patient has scabies until somebody noticed there's a burrow. They burrow into the skin, same as scabies, same as ticks. So you know those, you know the droplet, you know, contact isolation. No, review nursing process. Uh, for assessment, it review that there are, you collect data. There's subjective data, and that's directly from the patient. And the objective data will be everything else, right? Your assessment will be objective. Diagnostic testings, lab results, lab tests will be also objective data. And then from that, you will have the next process will be what? Nursing diagnosis, or another term for it is human statement. And there are three. So let's say pain, patient had fractured hip. So patient will have pain related to fractured hip, secondary to blah, 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 secondary to fall. Everything is related to it. And then you get from that nursing diagnosis, you will do what? Goal, right? Planning. And you're gonna plan, and that needs to be measurable, short term, short term, long term objectives. Review that. There's also the use of proper use of body mechanics will be. Did you learn how what is the best way or proper mechanics to prevent work related?
Lowering the bed to waist level.
Okay, yeah, lowering the bed, do not bend, keeping your feet and shoulder width apart and bending the knees to lift. And always ask for help, right? In regards to hygiene, what is the best way to prevent
Wash your hands.
the hand hygiene? Yes, that's the best way to prevent what do you call that? The spread of disease. And if you kind of jot down the things I said and review them, you have 2 days, 2 nights to review those, and those will be. And if you did a good review, you'll do fine on quiz 1. Okay, that's about it.
Okay, thank you.
Yeah.
Hopefully it helped. All right.
Thank you.
See
Thank
you guys
you.
today.
Have a good night, doctor.
You too.
Thank you, doctor.
You're welcome.